This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
We're going to talk about scapular fractures today. We have a colleague who recently sustained a scapula fracture, so I thought I would just do a quick update. It's not the most common fracture. It actually represents less than 1% or about 1% of all fractures that occur. Unfortunately, we know about it because it has a significant mortality. So if you have a scapula fracture, you have a 2 to 5% mortality rate just from that scapula fracture and its associated injuries, because the scapula fracture almost always occurs in a setting of high energy trauma, so high speed MVCs, bad falls, fall from large heights, and they're very commonly associated with high injury severity scores, ISS scores. There's associated injuries in about 80 to 95% of people with scapula fractures. So if you see a scapula fracture, you almost by definition are going to find other fractures, usually involving the lungs or the head, and most people who die who have scapular fractures either die from their lung injury or their head injury. So rib fractures occur in about 50% of people with scapular fractures, clavicle fractures about 25%, spine fractures and 30%, 5% of people with scapular fractures have brachial plexus injuries, lung injuries are common, pulmonary contusions occur in 40%, pneumothoraces occur in 30%, and head injuries occur in 34%, and you can have a vascular injury in about 11% of people with scapular fractures. So the key is, we're not going to talk about too many management issues, but if you do see someone with a scapula fracture, remember to look for those other associated injuries. The patients are often very sick. You need to call your orthopedist to find out sort of what the next steps are. Sometimes it involves operative management, sometimes it's non-operative management. But these injuries are severe, and we need to look for the other injuries that go along with them.
The Emergency Medical Minute would like to thank our sponsor, Swedish Medical Center, for helping fund our nonprofit organization and make this podcast possible. Donations are essential to our organization to cover operational costs and fund the creation of our online courses offering AMA, PRA, Category 1 credits. So if you enjoy our show, and if you're able to make a one-time or recurring donation towards our organization, any amount is helpful. Please click the link in our show notes to make a donation. Thank you for listening.